Thank you everyone again for joining this conversation about the impacts of COVID-19 on Seattle's communities of color. I'm Grace Madigan, the director of the Evergrey. For those unfamiliar with the Evergrey, we're an almost daily newsletter that aims to connect people, readers, to the city and each other. And we've been working with Civic Commons for the past few months, year, on different projects, very much in line with that idea of getting people connected with the community and how they can support different organizations and issues. We've got some great panelists tonight. Before we introduce them, or I'll have them introduce themselves, I'll pass it on to Frank to introduce himself in Civic Commons.
Thanks, Grace. Evening, everyone. So my name is Frank Nam. I use he, him pronouns, and I am the project director for Civic Commons. And what Civic Commons is we're kind of like a spin-off of the Seattle Foundation. We have some other partners, so we're independent, but we're connected. And our whole mission is to use the power of belonging, or amplify belonging where it is, or take away obstacles that create othering, for us to actually create a shared narrative about shared prosperity. Like, how do we in this region know that we're connected? How do we create those inroads? How do we connect those connections that are there? And that would help, sectors, industries, individuals, institutions work better together. A lot of the things that happen in Seattle when we try to work together are very transactional, and we're really focused on the relational. So we're really focused on the process. And so we're looking to shift narrative. And part of that is to have events like this with partners like the Evergrey. We host a podcast, we do other things as well. And we convene groups of people together to think about sharing resources, creating connections, and not being so guarded about the things that we're trying to hold for ourselves, but thinking about, the lesson of like abundance, not scarcity, and not have that scarcity mindset. And so we're excited to have three panelists who all are super involved in their communities, have been doing amazing work, have been, I'm sure, incredibly busy during COVID-19 and the pandemic. And so maybe we can go Abigail, Michelle, and Michael. Why don't you all introduce yourselves in that order?
Hi, good evening, everybody. I'm Abigail Echohawk. I'm a citizen of the Pawnee Nation on my father's side, and I was born and raised in the heart of Alaska amongst my mother's people, the Upper Athabascan people of Mentasta Lake, Alaska. I'm the executive vice president of the Seattle Indian Health Board, and in that role, I also direct the Urban Indian Health Institute, which is one of 12 tribal epidemiology centers located across the country. However, UIHI, as we call it, is unique in that we work nationally to represent the needs of urban dwelling American Indians and Alaska Natives, including those of us here living on the lands of the Coast Salish people here in Seattle. And I would like to acknowledge the Coast Salish people as we are on their land, and I'm very blessed to live as one of the few invited guests on this land. So I raise my hands in gratitude to the Coast Salish people and the opportunity to be on their land, to contribute to the vitality of this community and the strengths as we move forward, despite all of the obstacles of this pandemic.
Abigail, that introduction just warms my heart so much. Thank you for that. And it is an honor to be here and sharing this conversation with all of you. My name is Michelle Merriweather. I have the privilege of serving as the president and CEO of the Urban League of Metropolitan Seattle. And the Urban League started in Seattle 90 years ago, nationally about 110 years ago, with a focus on supporting Black African Americans as they migrated from the rural South, traditionally sharecroppers, to better worlds and better environments. And so our goal is to help that process and put folks on a pathway to success mostly through direct service and a lot of advocacy as well. And it's an honor to be here with all of you.
Hello, I'm Michael Itti. I'm Executive Director of the Chinese Information and Service Center, and it was created in 1972 by community volunteers in Seattle's Chinatown International District. And over the last 49 years, we have expanded to serve immigrants throughout King County, We have a staff of 100 bilingual and bicultural team members who speak Cantonese, Mandarin, Russian, Spanish, and Vietnamese. And we have a full range of services from early learning to healthcare information, after-school programming, and senior services.
All right, thanks for those introductions. Why don't we get this conversation started with this question? So this past year has obviously been a roller coaster for everyone, but especially for anyone who works in healthcare, and especially with those working with communities who have been historically marginalized. So, that said, what would you say is a lesson you've learned from this past year that you plan on taking with you in the work you do going forward? Why don't we start? Michael, you're at the top of my screen. Would you like to start?
Well, the pandemic has shown the tremendous resilience of our communities, right? Of the importance of working together across organizations, working with partners in government. But we're seeing the devastating impact of systemic racism. When we look at the cases of COVID-19, and then also the ability for people to access vaccines equitably. So we see that impact. We see the impact of communities who are facing, who experience unemployment over the last year and poverty. And so it's just incredibly important to, invest in community-based organizations. But for CISC, we created an internal committee to work on, becoming an anti-racist organization. And it's a commitment that we will be on a journey, for a long time, but we want to be able to work toward addressing the systemic issues that we see in our communities. So that's something that from this pandemic, it's a commitment for us to advance equity, but looking at it through an anti-racist lens.
Michelle, Abigail, either one of you have thoughts?
Sure. I will say the last year has certainly changed the definition. I guess I would say what we've all known to be true, the definition of essential, right, for everyone. Because there are some of us that did not have the ability to stop working, did not have a chance to slow down when the rest of the world kind of went inside. Some folks just doubled down and increased their work and truly became essential. The folks that were saving our lives in hospitals, the folks that were delivering our food and making sure our shelves were stocked, growing our food. So our definition of an essential people, certainly that definition is totally different than it was just over a year ago. And I'll also say that for us, just the importance of all of us working together to support community certainly was reinforced. We were certainly stronger when we partnered with other organizations to make sure that folks are able to pay their rents. We're able to get food. We're not traditionally a food service organization or food delivery organization, but when this first happened, we started delivering food because we work with a lot of kids in schools and realized that they weren't getting the 2 meals a day that they would typically get when they were in school. We were reallocating laptops that we had in our office to make sure that kids had immediate access to internet and Wi-Fi. Like, these are not things that we traditionally do, but our team just said, what can we do to help the people that we're serving right now, and just started doing it. So for me, the definition of essential just completely changed.
Really building off those beautiful words that were just spoken, is that I agree completely. It's both about the being anti-racist. It's about understanding who essential is. And then for my organization, Seattle Indian Health Board, and the work that we've done, it's also about making sure that a narrative about us isn't being shaped by the others around us. So when I think about, I never think about American Indians and Alaska Natives as historically marginalized, because I don't assign Western history to us. I refuse to let Western history be what defines communities. That's not the definition of my community. I come from thousands of years of ancestors who historically prayed for us, sang for us, survived so that I could thrive, and so our communities and the next generations could thrive. So we're all about shifting the narratives to ensure that the true representation of both the disparities and the resiliencies of our communities are what are shining through. I am institutionally underserved. I am colonially impacted, but I am historically resilient. And that is who our communities are and who they will always be. So when we even think about the distribution of the COVID vaccine, the Seattle Indian Health Board, the moment the pandemic arose, we got right into working gear. And truthfully, we knew how to do it. We just didn't have all the resources that we need because, again, the US federal government has never fulfilled its responsibility to Indigenous peoples. And so we lacked basic things like PPE. In March, we asked for PPE from the state, the county, and the feds, and they sent us a box of body bags instead of essential PPE when I had our physicians making their own fabric masks because we had run out of PPE in order to serve our communities well. And so while I look at that as both a shame on you, US government, county, state, and others who should have been providing the resources we need, I also look at the strength of our communities who sewed masks, who showed up every single day. I've never worked more in my life, and I've never been happier to do so, to ensure a thriving community that survives this pandemic. And so it's been an incredible honor. We've been shifting the narrative. Seattle Indian Health Board was the very first to vaccinate Seattle public school teachers. We are the very first to vaccinate 50 plus, and we have been some of the very first to vaccinate children. And so we are doing an incredible job, and that's the narrative that needs to lead, that says we need the resources because we know how to serve our communities, and we are the ones who should be serving our communities, not outsiders who want to shape narratives about us that are deficit framework based instead of recognizing the incredible historical strengths of our community.
Thank you so much for that response, Abigail. And thank you for adjusting the frame, right? This is not about a historical underserved. If you think about Native communities in this region and this continent, it has been historically prosperous and bountiful and amazing and innovative. And so to change that mindset is something incredibly important. I thank you for adjusting that for us. And I for one, I'm Korean born, grew up in New York City and Seattle, but I'm back in Seoul and the land of my people. And there's something being connected to the place you are and the land you're from, and having generations and generations have lived here is so incredibly powerful. And I can only imagine what I would feel like. I know how my grandparents felt because they were all born in occupation, right? But Japanese colonial occupation. And so I think a lot about that and the impacts and the generational trauma. But thank you. Like it's just, so many lessons that I feel like I've learned in the last couple of years have come from Native communities and Native understanding, especially around like pushing back against scarcity, the idea of like the village model. And so I appreciate your words and your wisdom. And my next question really is kind of a pivot to that because, I'm sure you all believe like the best solutions to community issues should come from community. Right. And the people, we have the IP that, we know the intellectual property, we know how our communities work, we have the best solutions. And institutionally, we're usually underfunded or almost always underfunded. But you all have community members that come to you, they have needs, they ask for things, they want connections, they want resources. How has that changed with the pandemic? Michelle, you kind of touched on this, right? Because you're saying we're not a food service organization, we don't like lend out laptops, but you pivoted because the needs of your community changed. And so I would love for you, all three of you, to like pull that thread a little bit more. Like, how has things changed in terms of what people need? And actually looking forward, how do you think things will change in the future as we round this corner around vaccinations and other things? And do you think things will change? So let's go, anyone, popcorn.
Sure. The Will they change? God, I hope so. You know, that everybody is so focused on getting back to normal. What we all know is normal I was didn't serve us, and so didn't serve us well. So what I think Abigail said it beautifully. Like we know what serves us best, and I will say we in the last year especially we have been the recipient of a lot of resources to support our community, and my fear, I guess, is that there will be a selective amnesia and we'll go back to normal once we get everybody comfortable and everybody vaccinated and moving forward. But my hope is that thinking future wise is that we don't forget what last year took us away from, because we were separated from our families and our grandparents. And I'm a family person and like to be with my family and very close to them. So it was hard for me personally to be so separate from my family. And so I hope that in general we don't forget what we lost last year, the people we lost last year, the sacrifices we all had to make, but the work that those essential people have put in. And so I hope that we don't go back to the status quo, because that did not help us. But what I think I'm grateful for last year, and that I hope we continue to hold on to, is that we helped each other out. We supported each other. We made sure that our friends were, we checked on our friends, even if it was by Zoom, because we wanted to make sure that they were feeling all right, that they were doing okay, that they had the things that we needed. We, folks checked on their neighbors to make sure that, and our elderly. And we found places to house those that are experiencing homelessness. We did the things that we should have been doing just naturally, and we figured out how to do it relatively quickly. Was it perfect? Absolutely not. Is there more work to do? Definitely. But the fact that we, it feels like forever ago, but remember that our state was probably the first to raise like $25 million, like literally overnight, to support folks that were doing work. So, I mean, I think, I just, my fear is that we'll have amnesia and we'll forget. But my hope is that we, at least those of us that are doing the work, remember and keep it going.
Yeah, Michael, Abigail, do you have a response, or do you want to talk a little bit about like some of the things that you're seeing from your community in terms of needs and et cetera?
Yeah, I totally agree with, we cannot go back to the status quo. The status quo was killing us, which is why the pandemic, I think, illustrated to other people what we already knew was going to happen. So when the first whispers of the pandemic began in January, my team, I'm an epidemiologist, and so it was one of the things I began to track, and I work nationally with the CDC. We knew what was going to happen. We knew Native people were going to have the highest rates of hospitalizations and deaths in this country, which is what the data tells us right now. And we began to prepare for that within our own communities, and then with the work that we do nationally. So the Seattle Indian Health Board, we immediately began to evolve. We, shifted the way our clinics worked. We had some folks when we opened up for vaccinations for 50 plus, again, the first in the county, in the state to do so for anybody, regardless of race and ethnicity, our phone systems crashed because we would normally get about 7,000 calls a week. We got more than 7,000 calls in one day. And so through generous donations of private donors, we were able to bring together and put together a call center. We've really depended on outside resources in a way that we haven't had to do in the past to compensate for where we weren't getting resources. And I think for the very first time, I don't beg people for money. I tell them about what we're doing, but I think they almost want to hear that kind of begging story, and we don't do it. Instead, we educate and advocate. And I've actually had to do not as much of that as of late, because there is a wider knowledge of the disparities that are existing within communities that impact not only people of color like American Indians, Alaska Natives, but the fact that it impacts the whole community. And the Seattle Indian Health Board, we see ourselves as part of the community. We are there to serve Native people, and we did that from an equitable perspective for the vaccine, for example, with a set aside of more than 65% of our allocation for our people, but we're also part of this community. So when they said, put your teachers back in school, and the state wasn't vaccinating teachers, we did it in partnership with Seattle Public Schools. And so seeing that kind of innovation and to be able to do that kind of innovation hasn't always been possible through the restrictive funding mechanisms of both private foundations all the way to federal agencies, is that we haven't had that flexibility. And what I hope stays is flexibility, is people not noticing disparities in communities they had never noticed before this month or next month, but they should know about it for the rest of their lives as we move to eradicate disparities and racial inequities. We need to maintain this level of awareness, and we need to have this continuous ability to serve our communities in the way we need to. So for example, our partnership with the Chief Seattle Club, where my sister Colleen Echohawk has worked at getting people housed, working for the first time and having some of the largest number of Native people getting housed. That should have happened a year ago, 10 years ago, 50 years ago. It shouldn't have had to happen because of the pandemic. So there are some incredible lessons learned about how we address racial inequities in a way that really values the humanity, the generosity, and how every single human being contributes to the overall vitality of this community and of the nation. And so I'm excited to see that stay. And I also encourage people who are folks who have the opportunity to donate, to contribute to the work that we are doing across communities of color. Do it, donate to us. We're doing a great job. We're serving communities, and we're serving you because we are all part of a community. And even though the direct service may not have reached you individually, think about yourself as an individual contributing to a larger whole. And that's how Native communities right now have not only survived this pandemic, but we, again, have vaccinated more community members and people outside of our communities than anybody else in this nation.
Yeah, Michael, what do you, I don't know if you want to add on to that, the question in this thread. Yeah.
Well, I just really want to echo what Abigail said in terms of funding, right? I mean, it shouldn't take a pandemic for us to be well-resourced. And so I really want to encourage and really lift up of what Vu Lei has been saying, you know, in the nonprofit space, that foundations should be really driving more funding to support and build capacity in community-based organizations. I really shudder to think what would happen if we weren't around, right? If we weren't here to support our communities. You know, the dozens of nonprofits throughout King County have been on the front lines each and every day, working to provide essential needs, and now advancing, you know, providing vaccines and advocating for vaccine equity. So it's just critical to continue this this level of support to grow and expand organizations that are serving communities.
Yeah, before Grace jumps into the next question, I just want to thank you for these responses. The restrictions around funding, what Abigail said about like how she has to do, you have to do less explanations about why people need to give and support and donate and resource you all. You know, that's something that is just wild to think about, how much nonprofits and communities had to like convince, especially white people, that they are disparities that are killing us, right? And that, you know, and just like to always go through our own trauma to get them to realize that it was so awful for all of us. And I'm hoping that this shift where more people are doing their own learning, are doing their own reading, their own, you know, taking the journey and really like just moving forward on that path without BIPOC communities holding their hands, right, and like leading the way, I think is going to be incredibly helpful for all of us. And yeah, I think VU should run like all the big foundations in America and like just be like, here's like a 5-year grant. I don't even want to report your community. I trust you. Like it's general operating funds for everything. Like you go do the great work you do. Like let me know what else you need, right? And so I think that type of funding is just amazing. But yeah, so thank you for that. And I'm going to switch it over to Grace for the next question.
Yeah, thanks you guys so far for, you know, these answers. I think like kind of going off of what we've been talking about, one of the threads to all of this, or that underlies all of this is, you know, racism. And obviously this has shown itself in a lot of different ways. You know, clearly that the disparities in health have highlighted that. There's a ton of different things. Seattle King County Public Health declared racism as a public health crisis last year. What would you guys say are some of the public health treatments, in your opinion, needed to fight racism? Obviously, a lot of it is up to the individual to like educate themselves, but are there health treatments or things that could be used to fight racism?
Anyone can feel free to jump. Yeah.
I guess I'll jump in on this. I'm an epidemiologist. I'm a longtime health disparities researcher, working with my communities. At least that's what Western science calls me. But I'm a storyteller of health, and I come from thousands of years of generations of Indigenous scientists. And so when we look at the impacts of health disparities in communities of color, they're all grounded in racism. That's where they came from. That's where we have to start with the acknowledgement of within public health. And unless we do that, we're not going to address any of them. So I've been blessed to be a co-author on all of the papers that have come out related to the disparities in the Native community, 3.5 times more likely to be infected as compared to non-Hispanic whites in the country. We're 2 times more likely to die. Right now, we're like almost 4 times more likely to end up in the hospital as a result of COVID-19. And as we look at all of these disparities, some of them are rooted in the historical inequities, multi-generational homes, crowded homes, inability to wash your hands. The CDC put out recommendations for hand washing with warm water when we have 30% of tribal nations across the nation who don't have running water as a result of environmental racism. And so here they put out recommendations that are really great for white people, but didn't meet the needs of the community. And so for public health needs to look at itself. And as when we think about Western equity approaches to addressing racism and public health, we've been working on this for years, 30 some years. Equity efforts to undo racism are embedded in racism themselves. And until we get uncomfortable and challenge the status quo of even how we're addressing, attempting to reach equity and to address racism within our own organizations and the wider society and the way that healthcare is provided, the way that we look at the social determinants of health, until we do that, until that work is done, everybody can, I just had the opportunity to testify in front of Congress about this exact same thing. And they asked me, it's like, well, the CDC is going to, you're saying racism is a public health issue. They all say it. Where is the action? And right now it's been community-based organizations, people of color organizations who have been working to undo the racism when that's really shouldn't be our job. Unfortunately, it's part of what we have to do, but we need the structures of inequity that are perpetuating and are built on racist systems that were meant to marginalize, and for American Indians and Alaska Natives, specifically eradicate us with the purpose of not only taking our resources, but undoing the treaty and trust responsibilities that the federal government has to us. Until we do that, nothing's going to happen. So I am both optimistic and pessimistic all at the same time. My organization just released a report we call Data Genocide, and it focused on these systems of inequity in public health that are eliminating us in the data, because then because we are American Indian Alaska Natives, our treaty rights are tied to the way that healthcare is provided to us, even here in the city of Seattle. And by eliminating us in the data, the federal government doesn't have to allocate the resources, and so they don't. It is a purposeful, continuous erasure that is an absolute genocide on our people. And so when I say that, it makes people very uncomfortable. They don't want to hear they're part of a system of inequity and King County Public Health that is helping to perpetuate a genocide. That makes them very uncomfortable. We have to get uncomfortable if we are going to address the racism within these systems that are continuing to kill my people. And I unfortunately don't and never did have the opportunity to not realize racism was embedded in the way that healthcare has been provided. I'm hopeful with the number of people who are saying more of these words. I'm still not seeing the action that I think we need to see in order for another pandemic not to do what this last one just did.
Thank you so much for that. Yeah, I think that's, something that's so difficult when we talk about addressing racism is, so often it's up to the actual communities of color. People look towards the communities of color for the solution, even though there's not one easy solution. And, that's tough for so many different reasons. Michael, Michelle, do you guys want to add anything?
Well, I just want to mention that, with health and well-being, I mean, the social determinants of health are so critical, right? So we know the educational opportunity gaps, the type of job, and whether the healthcare is included in that. There's just so many factors that are included in terms of being able to, to have full health potential. And then racism impacts all the different factors in the social determinants of health. So it's really something we have to work, systemically.
I agree. I mean, I think at the end of the day, we've been fighting this for so long, and it's an uphill battle, but it is not ours to fight. Like, racism is not our fight. Like, we didn't create it, we didn't invent it. We are suffering from it. We are dying from it. We've been erased from this this earth from it. But until white folks just understand that it is their battle to fight and their burden to carry, it's great words. It means a lot. It's a start, but until they, as Abigail said, get uncomfortable and start doing the hard work and the heavy lifting, we'll remain here. We can coach you. We can tell you till we're blue in the face, but until you do the actual heavy lifting and the hard work and sharing space and getting out of the way and providing the resources equitably, we'll be having this conversation until we're no longer here. And our children's children will be having the same arguments and the same fights until we all decide that the folks that created it decide to eliminate it.
There's something that, and thank you for that, Michelle. I think all three of you touched on this, but Abigail talked about when you all received the vaccines and you thought about keeping only 65% of the vaccines for your community, but knowing that you're part of a community, you're part of this greater world, and so knowing that your teachers needed help, you jumped in. People over 50 needed help, you jumped in, and I think that's the amazing thing about the way I think communities of color think about the way we are connected with each other, because there's so much more. I don't know how to say it well. I'm sure I'm not gonna say it right, but I feel like there's so much more empathy and understanding and a willingness to understand. It's like we're not just about a scarcity mindset where we just want this thing for ourselves. We actually want to build cross-cultural coalitions that are incredibly connected, because we know that, and the other things that Abigail said was the racist systems, we can't undo racism with racist systems, right? It reminds me of the quote, the master's tools will never dismantle the master's house, right? And so how do we imagine incredibly different, more powerful ways of systems? Think about how the economy works, how do businesses work, how does government work, how does representation work? Until, if we keep trying to do the things the same way that we always do, I think it's going to be incredibly slow going. But I think the most powerful way to do it is to build across our differences and know that actually we're incredibly similar. And how do we create these movements? Because I just saw I heard the woman who runs the Asians Advancing for Justice in Atlanta. They had a big push with the shootings of the mass shooting that happened recently, and just listening to her talk about the coalition she was building, how she was talking with Stacey Abrams and different communities, and trying to build this and I don't see that in Seattle as much. I don't see not since Uncle Bob and Larry Gossett, and the Gang of Four did work together. I would love to see more of that going forward. because there's so much power in all our communities and so much wisdom and so much like grace and so much love that I think we need all of it, to get better. With that being said, I just want to be mindful of time. Grace, can you remind us when is this supposed to end? Because I'm terrible with time, and time is a weird construct.
We've got 20 minutes, so
We got 20 minutes. Great.
we have time for these sort of tangent conversations because I
Great,
do think
great,
they're
great.
important. Yeah, and they
Yes.
add a lot. So no, this is great. We can keep going.
I will say to that point, Frank, that some of us have been trying to build that coalition. I work a lot with Colleen and Estella and others. We're really trying to bring that spirit of collaboration back within communities of color, and are here for it, right? I think we love it. We thrive on it. Like, when I first got this job, I think back, 4 years ago, Colleen was the first person to reach out to me and like, how can I help you? How can I support you? How can we partner? And, so and Estella the same way. So I think that we are working on that. I think certainly the pandemic last year had us kind of all trying to figure out how to save ourselves and save our community, but it also at the same time brought us together and reminded us that we have a shared interest in our survival, right? And so I think that it's coming again. I know that it's coming again, and because we all rely and communicate with each other and lift each other up in powerful ways. But I think in that we are also very strategic people. So I think we're sitting here strategizing on how to do this right, because we do realize that we're fighting a big force, and so we're working on it. We are definitely working on it.
I just want to say, I think maybe I could have come off as like an indictment on Seattle not doing this. I think it's more about the people that want to do this work and are doing the work, like you're saying. The way the systems are set up, we're so overstressed. We don't have the time. We're trying to raise funds. We're trying, so just to be able to do that, we're not given the freedom and resources that we need to actually develop these coalitions in a powerful way. And we're juggling so many things because of all the things that racism does to us. That but I know that the willingness, the desire, the want is there. But there's so many things that are structural and institutional that are blocking us from doing that. Someone should just like drop a huge grant on this coalition building and be like, but I'm hogging the conversation. Michael, Abigail, please jump in.
I was going to say I agree completely to what Michelle was saying, is that there are a lot of little pockets of where we're doing whatever we can to support each other, and kind of who fills in where. I think about this coalition that I'm really blessed to be a part of called the Equal Start Community Coalition, which is addressing maternal and infant death within King County. And it is a intercultural people of color coalition, and is probably one of the greatest strengths in us ensuring that our moms and our babies and other people who birth get the resources and things that we need, and that we fight for them. And then also when other issues arise, for example, right now we know that there's an active investigation of Seattle Children's for racism, embedded systematic racism that has marginalized and hurt African-American people working within their system, and then children and families of color. And what we have seen is the incredible strengths of the community, the people of color community who have come around, supported the people who have raised these, they call them allegations, but who have raised these issues up, who are standing with them, and who are forcing Seattle Children's to look at the fact that they simply are not doing well with their people of color staff, where they're harming African-American people working within their hospital systems, and that their children and families are suffering for that. And to me, it's building off of the work that that group of people who have been building towards the health and wellness and safety of kids of color and people who birth, to support them. So I see the strengths of the Equal Start Community Coalition that came around that. And I know there are so many other things like that right now, but you're also absolutely right. I love going to that meeting. It's 2 hours once a month. And I'm lucky if I can make it for 30 minutes of it because of the other things that are literally life and death for my community. And because of those scarce resources, which is part of the embedded white supremacy and racism within the systems that, you know, don't allow us to push forward these kinds of agendas and opportunities for collaboration and building forward in the way that we could if given more opportunity.
And Frank, since you did mention the Gang of Four, I do want to make sure that folks know about a book called The Gang of Four, and it's the legacy of all the leaders that created and invested in community-based organizations. Bernie White Bear with United Indians, and Bob Santos with Interim, Larry Gossett with the Central Area Motivation Program, and Roberto Maestas with El Centro de la Raza. So incredible legacy, and shows that we have a tradition here in the Seattle area of working together to fight for social justice and racial equity.
I think, because I know Seattle well, if there's going to be a city that helps that does this well, and or a region that does this well, I think we have the people and the willingness to do it. Yeah, and the Washington Census Alliance is also another example that I've seen of amazing like cross-racial like coalition building around like getting people to make sure that each vote counts, to use trusted folks from the different communities to come together on a statewide campus movement. And I know now that it's called the Washington Community Alliance, I believe, and they're pivoting from that work because they've built these amazing statewide coalitions from immigrant refugee communities to communities of color. And now they're thinking about what else can they do? How can they use this power and this like coalition to like keep moving forward for the advances that they want and deserve? We had a question in the Q&A, and it says, the public generally thinks that money is the most limiting factor to doing the work. Are there other major obstacles to do more or better work? And so if anyone wants to take a shot at that, please do.
I think money certainly is one of them, but I think the strings that come with that money often are the part that shifts our focus the most, I think, or takes away from the work that we have to do. So all the strings that come with the money, I think, are the part that we have to reckon with. Like, is it, while we maintain our mission and make sure we're going, doing the work that is serving the people that we are called to serve or represent. So, I think that's a challenge for philanthropy and government to certainly reckon with, and those that hold those purse strings. And I think we've said it earlier, like, allow us to do the work. We know what our folks need. We know what will help us not only survive but thrive. But adding the extra burdens that or reports or other things, whatever you want to, there's always strings tied to a lot of the funding. So yeah, money is part of it, but it's not just that. It's the fact that we are researched and studied and to death, literally, without the proper resources to provide the support that we need.
Yeah, I totally agree with Michelle. And one of the things that I always think about is, and I just actually had this conversation with one of our tribal elders this morning about how, and so for example, in our organization, we are not seeking money. We are seeking health and wellness and the reclaiming and the revitalizing of our traditional culture and value systems that this system of Western oppression continues to try to rip away from us. And so we use money as part of the resources to do that, but it's not all of it, and nor can it be what drives our work forward. Right. And so we strongly believe that the Creator will bring to us the resources we need when we move forward in a good way that brings together our elders, our youth, our cultural knowledge and value systems, our connection to the land, to the people, to our responsibility to each other. the reclaiming of our cultural knowledge and value systems is who we are as Indigenous peoples. And we at times use funds to help supplement that, and they are definitely helpful, but they are not at the core of what we do. However, trying to achieve what I just said is very hard in a country that is still trying to kill us. And so those embedded systems of systematic racism that are working and doing their best to eliminate us make achieving those goals very difficult.
These are amazing responses to that question. It's just, Abigail, I kind of want you to just like take my whole life and reframe it constantly for me, because the way you frame and reframe things is so powerful, and it expands the horizon so much in your responses. So I really appreciate the wisdom there. But yeah, so I think you.
I was just gonna say thank you.
Absolutely.
You should be my sister, Colleen.
No, it was, I know Colleen very well, and
she's older, by the way.
My goal is actually just meet all the Echohawks. So just that's my plan. That's the only reason I do any of my work. I've met Takatsu as well, so yeah, I'm on a roll. Yeah. Grace, I think, has a question as well now.
Yeah. So the impacts of COVID-19, we're starting to see them. We obviously see like them right now, but we know it's going to last. These impacts are going to last for a very long time. From your perspective as community leaders, can you talk about some of the impacts that you're expecting to see down the line that maybe we haven't thought about yet, or probably you guys have thought about, but maybe the public hasn't?
Well, for the Seattle Indian Health Board, one of the impacts that we're definitely working towards and partnering with our community partners is looking at housing. We know that when the eviction moratoriums lift, that we're going to have a large number of people who are going to be displaced out of their housing if we are not very cognizant and careful and move forward in a way that makes sure people are housed. We've also seen detrimental impacts of COVID-19. We've seen a drop in our prenatal visits. Moms and people who birth are somewhat afraid to come in because of the perceived risk to their child if they were to get COVID-19. And there are still folks who are pretty uncomfortable with getting vaccinated while being pregnant because there isn't as much data as we would like on how that impacts moms, babies, and people who birth. So we're also seeing, we saw a significant drop in folks who are accessing our substance use disorder services of a variety. And so we have a lot of impacts for people who have been the most disenfranchised. And we're looking to do everything we can to provide them the resources, the services, the love, the compassion, the grace, and wrapping around them in a harm reduction way, just basically how much we love them, how much we care for them, and how we're going to do everything we can to make sure they receive what they need in order to have healthy, whole, thriving lives.
Well, go ahead, Michelle.
Go ahead.
Well, at CISC, we serve several thousand older adults throughout King County. And so we've been, tremendously concerned about the social isolation during this entire pandemic. And so we know that mental health and well-being is going to be really critical. And a lot of our providers, like Asian Counseling Referral Service, they're seeing a lot of complicated issues right now and a lot of demand for mental health services. So there's going to be a huge need to continue to expand and support mental health and wellness work, especially in our communities where there's a lot of stigma around discussing those issues. And so we want to make sure the approaches are culturally appropriate as well.
Yeah, I when this first started, I had two major concerns, and they're still growing. One is certainly when the moratorium is lifted, we have probably embedded about $4 million into the community in just rental assistance. And that's just, I think, a drop in the bucket of what is needed, right? So my fear, unless something is done, we will have a huge challenge of those, of supporting those a growing number of those that are experiencing homelessness or losing their homes to foreclosure. So something needs to be done there. And that is one of my biggest fears. My second which is probably my first, is our children. The fact that they were isolated for so long, one with their families, which I think for many is a blessing that they got to spend so much time with their families. But there are those that may not have been such a blessing. And then second, I don't know that I'm as concerned with the quote unquote learning loss, which is certainly there. I'm more concerned with their mental health and stability when they go back to school, and making sure that they're okay, because they also have lived through a year of great challenge and trauma, and yes, learning loss, which is certainly important. And we have to make sure, especially Black boys and other kids of color, that we're not served well by the school system already. And then, having to rely on mom and dad to support their school environment while mom and dad have to go out and go to work. They are not working at home. So I think we have a lot of work to support and wrap our arms around the next generation to make sure that the impacts of last year don't harm them even further down the line. So those are probably the most two, or the biggest two challenges that we're trying to prepare for and wrap our arms around as we go forward.
I've spent a lot of years coaching at Franklin High School and working with youth in the South End of Seattle. And I know that their ability to do sports and activities and be out with their friends has a major, major impact on their mental well-being. And the organizations I work with have been doing a lot of like Zoom things that we do. Like they played like Dance Jeopardy, where like you get a dance and you may not know it, but then you dance it however you want, and then people vote. And if you get the most votes, then you win the points. So, I mean, young people come up with the best ways to entertain each other online, but even that does not compare to the proximity to people, right? And the ability to build relationships. And so I think about that as well. So I thank you for your answers, all of you. Super insightful, thinking about, the different people in our lives and our populations, and the impacts of this going forward are to be seen. And it's always, I think, communities that are connected know what's going to happen. They already see the ripples coming, and they can already plan ahead for what's coming in the future. But with that being said, and with only 5 minutes left, we have listeners. We're going to be rebroadcasting this on Facebook Live. On Facebook, we're going to be rebroadcasting this on the Seattle channel. So we're going to have more and more people listen in. As people listen to these conversations and hear from you all, what is something that you all would need or want them, our listeners, to do for you or for your organization, for your movement? What is that thing that people can do that you can share at this moment? I'm sure there's lots of things, right? But maybe like a minute and a half each. Like, I would love to hear from each of you what you think. This is when everyone looks at each other and sees who goes first. I love it. I'll make it happen. All right, let's go. Michael, Michelle, Abigail.
Well, one area that I want people to leave with an action is we're seeing unfortunately an increase in anti-Asian hate and racism, and a lot of it was due to the ex-president's words last year. But as we'll know in the next couple months, and as kids go back to school, there will be more and more incidents. And so each person in the community can play a role and to help provide public safety by taking bystander intervention training. And there's a good training course that's offered by Holla Back, and in partnership with Asian Americans Advancing Justice. But each person will learn strategies they can use and help to intervene or document or to get help for anybody who is experiencing any hate or bias in the community. So I really do encourage that everybody take that training, because as you're on the bus or walking to a grocery store, you might be in a situation where you can help somebody who's in need.
Thank you, Michael. I appreciate that. I also would say two things. One, in order to eradicate racism, those that are those with the power are responsible for ending it. So if it's in your own home, at work, you have the power to stop it. And then those within my community, I say, get vaccinated. I recognize the fear. I understand it. I share it. But I do know that this is our shot to get to save our own lives, right? And our opportunity to hug our grandparents again, and grandparents to be with their grandchildren, and keep our community safe. So get vaccinated would be my call to action for my people.
I will echo the get vaccinated. It is so important to, in our community, we see it as an opportunity to be a good relative and a good ancestor for those next generations by getting vaccinated. I would also encourage other people to recognize and to seek out opportunities to address the implicit bias that we all carry. Every single person carries implicit bias. We see that bias in news stories and media and things around COVID-19 related to our communities, where they only want to see deficits and they don't want to talk about the strengths. So begin to recognize not only the implicit biases around you, but the ones that you carry themselves. The Harvard Project has some really great ways to look and kind of understand some of your own implicit biases, and know that these biases are embedded in the systems that are the ones that are supposed to be supporting organizations of color and people of color in undoing systematic inequities and racism. And until we address them in ourselves, and I will say I have them too, we all have them. And until we do that, we will not see the change that we want to see for our next generations. And in my family, we always say we sing songs for our children's children, because their future is the one that we look to.
Thank you for that. I think that's a really good way to end this conversation. I appreciate, on behalf of the Evergrey and everyone, thank you so much for joining us. I think this has been a really, really important conversation. So I'm really glad that it'll be shared, like Frank said, on Facebook, and then rebroadcast on the Seattle channel. So in case if you missed it or want to rewatch a section, you can do that. I will do one last plug for the Evergrey daily newsletter. You can subscribe for free. You just go to the evergrey.com. Yeah, we'll be hopefully doing more of these sorts of things with Civic Commons. I'll pass it to Frank to wrap it up on his end.
Yeah, thank you, Grace, and thank you to the Evergrey for the partnership on these series. Yeah, and just so much gratitude to our guests, panelists, like the generational wisdom that's come out from your experiences and your words. You all have so much different lived experiences and backgrounds, but to have them shared in this strange, weird digital world. Just for the feedback, I know we're already getting it on the chat, and I know we'll get it and as people continue to watch. But I thank you for your time. Your time is so valuable, and I appreciate you spending that time with us and to share and and I just give you a lot of love and blessings forward. And I hope that like a lot of safety and dreams are good dreams. So yeah, I appreciate you all. And with that, we'll end. But yeah, thanks everyone.